there's a lot of things
Right.
that's going wrong for America.
Right. I would say isolationism and um, too much government involvement from both the right and the left.
Yes,
And
I would agree.
yeah, yeah, that's the biggest problem.
Healthcare is another one, which I think, and I think the problem with that is also too much government involvement. People talk about like, well, the free market in healthcare, and the free market has failed in healthcare. There is no free market in healthcare. There hasn't
Yeah,
been in a very long time. The problem isn't too much capitalism. It's actually too little capitalism.
perfectly said. Completely agree with you on that. 100%. It's interesting because if you look at in the United States, the things that are the least affordable are exactly the areas where the government is the most involved. And then a
Yes,
lot of people want the government, and then the people want the government to come and fix it. Where if the government could fix it, why is it that everywhere that the government is involved is where we have an affordability crisis? So
yeah, exactly.
Yeah, but when it comes to healthcare, money is not the main objective, right? Or making things cheap, because something doesn't make sense economically. If there is a rare case of something to cure, that you will never make money out of that. So also prison systems, there are some things
wait,
that are the main objectives. Yeah.
no, making things cheap, it should always be the objective, and making money should always be the objective, even when at least one of the objectives, because whatever the objective is, if you don't do these two things, then you will not achieve your objective. So if the objective is for more people to have access to healthcare, right, you have to make it cheaper. You have to make it cheaper so you could actually provide more healthcare to people, because there's no unlimited money out there, right? And if again, the goal is to provide more healthcare to more people, then you have to be able to afford the cost to providing the healthcare, so you have to make money. So making more money and making things cheaper is always part of the objective, even if the primary goal is something else, because you can't achieve the primary goal unless you achieve these two.
That is true.
Yeah.
Yeah,
Hi guys.
you have to focus on making it cheaper. It's how you go about it that is the question. And
Right.
the way I would go about it is less government involvement and more free market.
Yeah, more competition. The way you increase quality
Exactly.
of healthcare and you increase the quality, you make it more less costly, and more
Yes.
accessible to more people, is that by making the private sector just compete against itself.
Exactly.
That's how you do it.
Exactly the problem with healthcare in America is the health insurance monopolies
Yeah.
that have been created and fostered by government itself, by government regulation, and by these companies colluding together, almost like the five families, of the mafia world back in the day, who they colluded together to take over certain territories. They have certain regions you can't buy you can't buy or shop across state lines. You're limited, and it chokes out any competition that would inevitably bring down prices.
Right, right. So, but by the way, I'm not in favor of zero government involvement. I think when there's positive externalities, right? For example, when it's like healthcare, education, there is
Yes,
a some role for the government to play. But if the
sure,
government wants to enter, it needs to come from the demand side, not from the supply side, right? So the government
exactly,
sucks at the government sucks at supplying goods and services. Every time it comes and does that, it's very inefficient at doing that. What the government
exactly,
can do is that, allow the private sector to compete, and then the prices will fall as much as possible. But then in that situation, there will be still some people that cannot afford it, even though this is the lowest price, like the lowest price. Then what the government can do, that's where the government enters. Those people that even though the prices are the minimum they could be because the private market is doing it. Now there are some people that are still left behind, and if we want everybody to be able to afford healthcare, this is what the government should do: just come and give them the money. The people
Yes,
who cannot
exactly.
afford healthcare, just you don't need to provide healthcare. Whatever money you were going to spend on healthcare, just give that. Like, it would cost a fraction of that to just the people who cannot afford the healthcare in the private sector. Just like, here's some money that you could only spend on healthcare. Here's yours. And this is good, because if the government tries to provide healthcare, it destroys competition because it's hard to compete with the government. But if the government gives money to the people who cannot afford healthcare, this actually increases competition, because the government now introduce more customers to the market. So now different private sectors have to compete with each other more, because there are more people to compete over. So this is actually increases competition.
Yes, exactly, exactly.
Right.
You nailed it. Yeah, I couldn't say it better. Those are my. I couldn't say any better. Those are
No,
my
I can
views
fraud the
exactly.
system. I can commit fraud like this.
What?
If you're just handing me over the money instead of like I don't know, a
Oh,
voucher.
no. You could say they're like, give credits, like healthcare credits, like that you have to spend on healthcare, right? But here's the
Not
thing:
cash.
there will all not cash. Yes. Like, it's like this much money that you could spend on healthcare, right? But the thing is
Yes,
that if you're looking for ways that people could use that this will cause fraud, anything that any method will open the door to some potential fraud. Like, there's not any solution that you could give me that I can't think of, like, well, here's how this opens the door to some fraud, right? Every method has its own cost. The one that will have the most fraud is if you just let the government run healthcare. That will have the most fraud. Okay, because so it's basically a cost benefit analysis, right? So
yeah,
to which one has,
exactly.
yeah.
Cost benefit, and it's a matter of degrees. Some are more open. Some things will open the way for more fraud, for more potential fraud than others. But you just go. But the goal is to do the thing that allows the least amount of fraud to be permitted. That's what you should always go for. Some are better
Right.
than others, and that's what you go for. That's all you. That's all you can do. You just go for the best result. And some will
By
be
the way,
better than others.
Dijon, your audio sounds so good. Did you get a new mic? You sound so much better now.
No,
Oh,
I still got. No, I'm still using my phone. It just, I don't know. It's just, I don't know why. It just is, I guess. I
okay. All right.
don't know why.
Francisco, you
But
want
yeah,
to?
I agree.
Okay.
Yeah, like
You agree?
vouchers is the way to go, and that would produce the least opportunity for fraud, since you would have to spend the money on healthcare. Then
Yeah, I disagree.
the way to go.
Right. Okay, Francisco disagrees.
Yes, I think a good model would be both, to have both full public and full private, because private healthcare kind of can focus on some niche, but giving free healthcare does not give bad incentive. Like, I would not break my leg, to get more money, or like everything. For example, if you pay for immigration, you get more immigrants. If you assist drug addicts, you get more drug addicts. If you finance healthcare, you don't get more sick people. You That is just a service that's there, that delegates. So
Oh, you
I think,
absolutely get more sick people when you have. First of all, when you say free healthcare, there's no such thing as free. Any service has
yeah,
been
yeah, I
paid
paid
for
with
by
taxes.
someone
Yeah,
else's work. Like
collective paid.
yeah, somebody has worked. So this is we shouldn't call it free healthcare, right? Somebody has worked for that, right? So there's a cost associated with it. But there's always, like, of course it's going to cause bad incentives when they think it's free. Like, people are going to go visit the doctor for an itch in their, on their butt. They're like, hey, I have an itch, can you scratch it? Like, right? Like, of course people are going to misuse that. But of course, like, I don't
I
know.
mean, I always
um
lived with under countries
but
that have free healthcare, and they were fine.
yeah, so Well, I mean, yeah, but fine is not fine doesn't mean the best, right? Fine, your experience from fine doesn't take into account how much more costly it is because the government destroyed competition. And if you have private and public, that's unfair to the private sector because the public sector doesn't have to worry about cost because it's being funded by taxpayer, and then private sector is always going to be less efficient and less strong because it has the private public sector to compete with. It absolutely destroys the quality of service and increases the cost, not just in the public sector, but also in the private sector because you're stealing their customers, and they would have been you're stealing a lot of funds that would have been more efficiently allocated in the private market. By the way, Asi wants to speak as well.
Yeah. I think I'm a little biased about it because in my country we do have healthcare. It's not completely free. You pay for it monthly through the paycheck that you get from work, basically, kind of like tax. It's not expensive. Anybody can afford it. It's I don't know. It comes up to it depends what kind of coverage you have, but it's between like I don't know $30 to $50-$60 a month. That's what it is.
That's
And
how much you pay when you go visit the doctor.
when I don't pay when I go visit the doctor, I pay monthly.
Oh, okay. So
And
it's government healthcare, and you still have to pay monthly.
yes,
Okay, so you do know that
they
the
subsidize it.
amount. Okay, so you do realize that when you say it's not very expensive, the cost is not the amount that you're paying monthly. That's a fraction of the
No,
money
I
that you're
get it.
paying.
But for
Yeah.
example, let's say that I'm a pretty young guy and I do not have parents to rely on. I did a motorcycle accident, let's say, and now the pays from the hospitals are so high that I would probably, and I am handicapped, so I will probably need to rely on food stamps for the rest of my life in order
Yeah.
to repay the debt to the hospital. So,
Yeah, but you are paying more than right now than if it was private. You might not realize it, but you're actually paying more. So the money that you're paying as a citizen, you have to. It's not just the $30 a month. As a society, you're also paying the government a lot of money to be able to run healthcare, right? So you're saying, but if the government wasn't paying me, then I would have to pay for healthcare so much. That is not true because if the government wasn't running healthcare, then the private sector would have competed with itself so much that the price would have been so much lower than it currently is if the government was not involved. So you're just what you're comparing it to your situation is like, oh, if the government wasn't covering it, I would have to pay so much. But no, but if the government wasn't involved with healthcare, the cost in the private sector would have been so much lower if you had just allowed the competition to do its job. But
But
you
there
are
is
paying
also
so much more than
competition. There's
no.
also
But listen,
competition. It's like four
hold on.
companies.
But
competition.
just a
You
moment.
have
Let's hear
competition.
him wrap it up. Let's hear him wrap it up.
no,
And I listed you. I
yeah,
put you all on the list. Don't worry.
yeah,
Okay.
yeah.
Okay.
So
Okay.
what was I lost my train of thought because I got
Sorry.
interrupted.
Didn't
You
know it's
What
at the
was
only.
I?
end of the day, you pay more and not less.
Yes. When you think you're paying $30 a month, that's not the cost. You're paying so much more in taxes, and you should be adding that to your cost. You have to calculate that as well. Yeah.
You basically say
Anyways,
that my let's say that my how do you say it the regular tax that you pay for how much you earn. I forgot how it's called.
yeah.
So this one will
So
go down. Okay.
the way,
Income
yes,
tax.
no.
Yeah.
What I'm saying is the cost. If you want to think about the cost of healthcare, you have to think how much you and the taxpayer as a whole is paying for healthcare. Okay, you have to count all of it and then compare it with a model that only the private sector was competing with itself, and then how much it would cost. Not under the current model if you just weren't covered by the government. That doesn't make sense to compare it like that, right? And that's what people don't see. There's a hidden fee. A lot of people who live in societies that have government, and I think we shouldn't call it free healthcare. We should call it government healthcare. Okay, inefficient government healthcare, they think they're being saved because they only look at the money that they're paying for healthcare rather than the money that is being stolen from them by the government through taxes.
Okay. So I saw Francisco, Shani, and
Yeah,
Kathleen.
I want Shani and Cat Lady to answer before. They were replying
Do
to
you want
Amir.
to hear Cat Lady? Okay, Cat Lady, go.
I must admit I didn't completely understand your argument, Armin. I would like to hear more, but there is actually four companies. It's like competing each other. There is a lot of course, it's government, but it's also like kind of a mix. It's like there is competition, very high competition, but I'm not sure. I would like to hear more what you explained, Armin. So maybe I'll let other people talk first.
Okay, Francisco.
Yeah, my point is the same thing of healthcare applies also for the justice system, for example, or education, because those are government service, and I don't think the incentive should be to make money or to lower prices. If you need defense, the government should give you a lawyer if you cannot afford it. Or yeah, that does this thing scale to everything?
Shani, your mic is open. Go on. Go on. Are you finished? Sorry, I interrupted you because Shani's mic was open.
Finished.
Oh.
Shani.
To you, Armin.
Yeah. Okay, I can explain. I could say I work in finance, so I could say a few things about we know what happens over where Asi lives. There are companies that they compete with themselves, and the government supports all of the companies in one way or the same thing. People pay in their paycheck a certain amount of money for healthcare. It's very specific. It has you know you it's very specific. It's like it could be between like 60 to maybe let's say $200. Depends how much your income is, but that's kind of what you pay for healthcare. And you have the option to pay to the companies that each one decides what company they want to go into. And that also depends, everyone has their personal need, so they will choose their choice of company, according to what they want to experience. Some of them are similar because they're competing. So, but they have a little bit of a I don't know how to say it.
Specialty.
Some, yeah, I don't know. People think that. I'm not sure. It's but eventually some of them have the same doctors. But it the government helps a lot. Some people don't even have a paycheck. Some people don't work. A lot of people don't work, and they still get health care as the richest man in the if he doesn't pay private is insurance. If they have private insurance, so that's a whole different story. But when you go to the hospital, you get in like the richest man, and the poor man will have the same service. They don't look in your paycheck. They take your card and they serve you. You have other, people play with it. They bring their people and everything, it's a whole thing. You could have your special person that comes with you, and he knows the doctor, and so also that it's like a another interesting thing. And people play with the idea. For example, I could say for them, an old age people, they get a certain amount of money to get help. And some people use the money for themselves and don't take the help. And some people need, use it for the reason why they got it for. So it depends. It's
No, but
very.
Shani, also you mixed in their social security
Yeah, you mixed it.
That's not
privileges.
social security. No, it's not. So it is healthcare. It's kind of healthcare.
Siud.
I'm talking about healthcare for all people. They get this siud.
Yeah, that's social. That's not health.
It is health. It is.
It's
All right, guys, but
running.
let's not get into too
Oh
much
yeah, I
of
don't
the
think it
details
doesn't
because
matter.
the general
Yeah,
point was already made. Yeah. So who's next?
Whoever feels like it.
Okay, I raised my hand. So okay, let me answer. All right. So when you said that there's it's mixed and there is competition, yeah, there's always competition. The point is not if there's competition. The point is that if there's enough competition. Okay, we're like, oh my god, I see competition. Yeah, whatever competition we see, when government gets involved, it kills the level of competition that would have been optimal to reduce prices and make things more efficient and increase the quality of the product or the service. Every time the government gets involved from the supply side, it kills competition. So if you're noticing competition, whatever competition you're noticing is a fraction of the competition that would have been out there if the government just stood the fuck out, right? In places that it has no business being in. There's that. Two, Yamiel in the chat saying taxation is not theft. I wasn't saying taxation is theft. I'm not an anarchist. Just because I want a limited government doesn't mean that I want no taxes. The government needs taxes. Obviously, we need taxes. But when the government, what I oppose is where the government comes and tax people to provide services that the private sector is supposed to be providing. That's where I oppose the government entering. Obviously, we need taxes because we need a government, and government has a budget, and government needs money to be able to run, right? So there's that. And then there was the point made that, this is something that, like, we need the government to run justice system or police. Obviously, these are the areas where the government is efficient in. This is what the government is designed for, and those are the areas that it needs to be involved in, right? The government is the best. So we have the private sector model, the corporate model, the private enterprise model, and then we have the government model. And through years of data, we have noticed what are they good at and what they suck at. The private sector sucks at running justice system. The private sector sucks at policing cities. The private sector sucks at providing an army to protect the nation. That's what we have the government for. That's what the government is good at. The government is good at stop providing laws, providing security, creating a fair and safe environment for the private sector to do its thing. That's what the government is supposed to do. Police, army, justice system, sure. But we also notice through years of data that the government sucks at everything that the private sector can do, like healthcare, education, and many other services. And what the government is supposed to, like, we want the government to be involved to make sure that everybody can participate in certain um, industries that are necessary, right? Like, healthcare, for example. We don't want people to be punished for being not productive by not having access to healthcare. Yeah, but there's a solution. Like I said, like I told the Joe, is that the government can get involved from the demand side rather than the supply side. We let the private sector do its thing. Anybody that falls behind can be taken care of by providing vouchers instead of the government providing healthcare itself. And then we had the point that the government helps a lot. The government doesn't help. The government. This is the problem with democracy here is because because it looks like the government is helping, and a lot of people vote for this because it very much looks like the government is helping. This is, if you think that because you go to the hospital and the government is paying for your care, and that looks like the government is helping you, the government is stealing from you. Okay, whatever, like, oh my god, I just went there and I'm being treated like a rich person. You're paying more for it than if the private sector was doing this. Like, you're being robbed. You're being robbed and you don't even realize it. This is basically the same reason why people fall from Mamdani. If people are impressed that if I'm not rich, I go to the hospital and I'm being treated like a rich person, the same as a rich person, this is the same thing as Mamdani coming and saying, I will have rent freezes, I will make the buses free. And people are like, oh my God, I like that. And they vote for this stuff. This is why leftist policies are popular in elections, because people think, I like free stuff, but it's not free. It's never free. It looks like free, but but you are actually paying more for it. You're paying more for it from your taxes, or worse, from inflation, because maybe the government is printing money to pay for this. You're being taxed. The fee is much, much higher than you realize, but it's just hidden and you're not seeing it. You would have been able to have access to more healthcare if the government wasn't involved. Done.
Exactly. And if you're too poor to pay for it yourself, you could be given vouchers in order to get health care. Like you said, right? You coming from the demand side.
Exactly.
It'd be much more.
Hey, Joseph.
I agree. It's not about leaving people behind. It's about how you do it.
Armin, can you give me an example where it was better when the private sector was running it, and why specifically in healthcare? Why is it different than policing? What's the point of
it's not it's a spectrum. Okay, so it's not specifically healthcare. It's everything that the private sector has been demonstrated that it's capable of providing, right? So this is not just like, we don't observe this in healthcare, we observe this in almost every industry, except when it comes to security, because the whole point of having a government is safety and security. That's the point of having a government. So we want government to focus on that and just let the private sector just do everything else. The private sector as a whole is like, it's basically, the private sector has been demonstrated in every area. The private sector has demonstrated to be capable to reducing prices, because here's how this happens. The private sector is profit motivated, right? So that's why if you're motivated by profit, you need to increase demand and reduce costs. You increase demand by improving quality, and by reducing cost, you're saving everybody a lot of money, right? Because you want your product to have a lower price. Oh yeah, they're motivated by reducing price and increasing demand. You reduce price by reducing your cost, and you increase demand by increasing your quality. And that's why, and because they're competing with each other, the ones who are not good at doing that, any company that is not good at either reducing its prices or increasing the quality, will go extinct. But the government doesn't have this motivation, because the government is not competing with other entities. So it's not that interested in reducing its price, because there's nobody competing with it. And it's not interested in improving quality, because that will cost it. In fact, look at the incentive structure of the government. The government is actually incentivized to increase the cost. You know why? Because that means more government employees. Because the more you could justify how much this costs, the more people will be on your payroll, on government payroll. So the motivation is the opposite. That's why they always become more inefficient compared to the private market. These other areas, like security, the reason why they're inefficient at that, like, for example, in war, they're competing with other countries. So the government is competing, right? So but with other countries, so that's why they will be inefficient. So for example, if the government is providing healthcare, it's not competing with anybody, because there's nobody else, there's no other government providing healthcare in your country. So because of lack of competition, everything will become more costly, and less efficient and lower quality. But when it comes to war, because they're competing security but competing with other countries, they become competition make things efficient. When it comes to policing and justice, because that's exactly what they have been paid for, that's exactly why people have elected them. And as those are the areas that as soon as it becomes as soon as you lose, people see corruption or see lack of safety, they will punish the politicians for it. There's a lot of pressure on them to perform well, so they're also efficient at that. But when it comes to other things like that, because people are fooled by it, because this is hard to understand, people feel like, well, I went to the hospital and the government paid for it, I like that. Because this is hard to understand why this is not the way to do it, uh, people will vote for that. So this is the part of democracy that is not working efficiently. Like this is why politicians can
Yeah,
promise
like
free stuff to
populism.
people. Yes, this is why leftist policies become so popular, because in the mind of voters, if the government is doing things for me, that means they're helping me.
Yeah, I understand what you're saying, but I'm not talking about like just believing in stuff. I'm beyond that, like I want to actually understand why, how can it, like, was it demonstrated actually in other places? Do you have like some model at some time in somewhere that was better?
So we have a general model for government inefficiency compared to the private sector in almost
Specifically
every
in
industry.
healthcare, I'm talking, yes or not?
So in healthcare we see, like, we're in places where we have, so here's the thing, because in healthcare we see every place that has both private and public, the private is becoming if the private sector is allowed to compete a little bit, the private sector gets more efficient and provides better services, right? We see that, right? Even though the government is making it difficult for them to do that. But the problem is that in almost every advanced country, because we have democracy, right, and people get fooled by the government providing services for them, and they like that and they vote for that, you don't see that any example of an advanced country with no government healthcare, without government healthcare. I mean, not that I know of, right?
Okay.
All the major advanced countries have some form of government healthcare. But it makes sense if you just apply everything we have seen from every other sector on how inefficient things become when the government gets involved, that it also applies here. And also, nobody could show us why this is not the better way. Like, why not the like anybody who thinks like, well, this would not work, just tell us why not get the government to come and provide the cash to spend on healthcare to the people who can afford it, rather than just providing healthcare itself. Like, why wouldn't that work? That seems to be the ideal method. Nobody can provide a good answer to that. Anybody who says that, well, it's good that the government is taking care of people who don't have enough money to pay for healthcare, well, our model does that. Our model does that.
So the
It gives
stories
them.
about people going and not being able to like fix stuff is like bullshit in America. I'm not talking about Canada. I'm talking about America.
America is not using the model that we're saying. America is no. America is the worst country for healthcare among all the advanced countries.
How is
America
it
is
in
not the
Canada?
model that. Hmm?
How does it work in Canada? I know it's better, but how specifically? Do
It's
you?
um. I mean, it's okay. I'm in Canada, but it could. I'm pretty sure it would have been less expensive
No,
if
but
it
is like
was.
completely government or is it private? What
Yeah.
what is it
No, it's completely government. Yeah.
I've heard some
like?
You
horror
just go to.
stories.
Okay, we have
One last question: is it more like in the UK where it's in the hospitals?
I don't know how UK is, but you just go to the clinic and you show your, health card, and
Is
then
it
you
good?
go
Is it good
you
quality and like?
well, compared to where? Because I've seen only one. I've only experienced
Oh, okay.
Canada.
Because
It's
the
better than
UK they're
Iran.
saying
It's better than Iran.
because
I
in
mean,
the UK the
it's
NHS.
actually, for me, it's not better than Iran, because in Iran, my dad is a doctor. He's a heart surgeon. So in Iran, I had access to higher quality healthcare than in Canada. But for the average person,
which is
it's
already a problem, but you said, right?
yeah,
But it's
yes,
okay.
yes. Yeah. You know, my mom, for example, my mom got cancer. She died from cancer, and she left Iran to come to Canada to see me. Because she was dying and she wanted to see me before she dies, right? And the quality of healthcare she was getting in Iran was way, 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 way better than in Canada. Way better. Like, she had her own private room, she had everything, she had multiple doctors visiting her every day. But when she came
Wow.
to Canada, that was weeks before she even saw a doctor, and she died shortly after because of how
Exactly.
long it
That's what
took.
I asked. Exactly. That's the problem of the NHS in the UK. They have everything in the hospital, so you have hours of waiting. You have like
Yeah.
it's too much for too many doctors. Like, there are problems. Yes.
Yeah, but she knew when if she comes to Canada, that's going to make her die earlier because she was not
God.
supposed to leave the hospital. But she said she doesn't want to die without seeing me, and I couldn't go to Iran because if I went to Iran, I would be executed. So that's why she came to Canada to die with her, like next
Damn,
to her family.
How long ago
Yeah,
was it?
this was, I think, more than 5 years ago now. Let me check.
No. Okay.
So,
That's around the time my father died.
oh, really?
Yeah.
Yeah, I think
yeah,
5
mine too.
years.
I lost my dad a few years ago from cancer as well,
What?
prostate cancer.
Oh,
What kind of cancer did your mom have, Armin?
Pancreatic,
Uh,
worst stages.
yeah. Yeah, sorry about that.
Yeah.
Cat, what did your dad die of?
So it's actually been longer. Oh my God, it really has been that many years. Jesus Christ, it's 2013.
we're growing up.
Oh wow, she
Time
died in
flies, huh?
2013.
Wow, it's been so many years.
Yeah, you sort of
It
wow.
doesn't.
You said 5 years. Yeah, that's a bit longer.
It doesn't feel like 5 years.
Feels
Hmm.
a lot more recent.
Yeah, it felt a lot more recent for some reason in my mind.
Traumatic
2013.
By the
events
way,
do that.
yeah. By the way, I posted a link to a picture of me and my mom in the chat if you guys want to see it.
Oh,
Take a
cool.
look at
Oh,
it.
check that out. Yeah, I'm sorry about that.
Aw.
We have
Oh my
we
God.
have Francisco, then myself, and hopefully Joseph will come back.
Wow, that's an amazing photo.
Oh, thank you.
Yeah,
May her
I'm
memory be of blessing.
Thank you.
yeah, I'm willing to change my mind on this topic, but I'm still not convinced. So probably like a good written post will help. But I have two problems with the private sector fully involved with healthcare. One is incentives, as if you are driven by profit, then you need more sick people. So that's I think a bad incentive to have in order to make money. More diagnostic or treating is like mental health. The incentive is to treat the least problematic people for the longest amount of time in order to maximize profit. That's point number one. Point number two is that different treatments have different costs. So some people have more rare conditions, and those will never be profitable. So those people, what should be just left untreated, or what's the? There is no financial incentive to cure people from certain disease. What you get is basically a lot of doctors that are able to do, I don't know, cyst removals or very simple treatment to a lot cheap, but then it's very hard to focus on exceptions. That's where the tricky part is, because those exceptions, those more rare conditions, they are the one that cost the most, because there is no scale on that. So two problems are the incentives and different costs for different treatments. That's my two biggest arguments against private healthcare.
Can I respond, or is there someone else?
Yeah, it's actually me, Joseph, and Daniel.
Oh, okay. Sorry.
I'll keep it short though. Two things. One, I think that the claim for healthcare in Israel is it started as kind of Mamdani thing. You're right. When if you mention it, and I need to look at history, you're right, because what happened in Israel is that the healthcare that they have back then was sponsored to people by union organizations, union workers, and stuff like that. And if I remember correctly, and kind of started to get out of hand, because politicians would come and they would come close to one of the union workers, and they would say, "All right, whoever votes for you gets healthcare. If you don't vote for you, he doesn't get healthcare." And then it created a mess, and the way that they settled on this mess is let's give everyone healthcare. And now I think that there would be a problem removing it, because people are hooked on this concept, and I'm not sure if we are pragmatic. I'm not sure how you transform a country, even if let's say that it's a good idea. I'm not sure how you do it. That's one thing. The second thing is a reply to Francisco. Maybe the government can't tell you. Um, um, let's say that it's a private thing, okay? But let's say that you keep the government involvement in, let's say, the type of doctor that you will become. Let's say that this year I need 5 spine surgeons, I need 3 shrinks. I'm just making up numbers. And I need I don't know, one guy who can deal with cancer and stuff like that. And they will say, okay, but how would you choose those people? Well, if they go to medical school, and so in the part that the guy was, I think, better in anatomy and bones, so maybe it's better thing that he will become an orthopedist and not something else. And so you pick the guy who had the best grades on this topic, you pick him to the thing, and you choose what the doctor will learn, basically.
Yeah, what was
Ah,
that
so
responded to? Sorry.
you want to reply? Yeah, just make it quick because we have a
No,
list.
no, no,
So
no, no, no.
reply
What was my point that you were responding to? I didn't. What was that
that it's
response to?
yeah, I wrote it down because I thought I
I
would
think he's
forget, and I did
responding
forget.
to me more than to Francisco, no?
No, because Francisco said
Oh, yeah.
that you need involvement, because
Oh,
people, for example, the people who check out cysts, it's not going to be profitable, and
oh,
they're
yeah.
not going to be cyst doctors. So
Yeah.
that's what I said. It's Joseph's turn, and then Armin.
Okay. I've been listening to this because for me, partly because of age, I understand some of this medical stuff. And to be honest about it, one of the biggest problems here in the United States is that the government is involved in the mess to start with it all. Up until 1968, and there's a specific reason why I'm choosing that particular year, medical costs were actually falling in the United States. The reason why 1968 is such a point in history is because that's when Medicare went into effect. Now, here's a reality that kind of gets lost in the whole healthcare debate is the the natural laws of supply and demand do not go and take a hike just because of people don't want it to happen. When you dump that many, because one of the first rules is you increase demand, price automatically goes up. Period. That's going to happen. And what happened was you start with Medicare and now Medicaid. That's what's driven up the cost. You've got this increased demand. Further exasperating the problem, it's not, oddly enough, it's not at the federal level, but at the state level in the United States is that the American Medical Association gets to decide who can and cannot be a doctor. It's a government mandated monopoly. Now, this is where it gets really worse. Is that the AMA gets to decide how many students each medical school takes each year. So you've got a group, the American Medical Association, which is not a government group. It is a private nonprofit organization getting to say, oh, you're only going to be allowed X number of doctors total per year, regardless of how many medical schools. Oh, and you have to be in an accredited medical school. Before the AMA came along, there was what used to be called lodge medicine. You belong to something like the Fraternal Order of Eagles, the Moose Lodge, Rotary Club, Shriners, Freemasons, etc. As a matter of fact, Shriners Hospital was started by the Freemasons. If you were a member of them, you actually paid less than you would an AMA sponsored hospital. The real problem has been and always will be when it comes to healthcare is government interference in it. You want to make drug prices cheaper? Let's get rid of the FDA, make a version of underwriter laboratories for pharmaceuticals, and I can guarantee you'll see drug prices drop radically because they're not spending, I think last number was almost $2 billion to get a drug from R&D to actual approval. And that's the cost. That's just the cost of the testing. Get the government out of the way and let people make the decisions on their own, and you're going to see healthcare prices really drop. There's a reason why insurance doesn't cover things like chiropractic or acupuncture, things that actually work but defy Western science. And for me, just if and here's my gripe about, and I'm going to point out the FDA specifically. Here's a problem with the FDA. You can have a drug that is safe, but the FDA won't approve it because they don't think it's as important or as good as current treatment. Not that all of us can take the current treatments. I can't take any of the cholesterol drugs. They do terrible things to my body. But there were other drugs that I might have been able to use that might have done it. But they're not approved by the FDA. However, they might be approved in Europe. But if I went to Europe to get them and brought them back, I could be arrested for drug running.
Wow.
So
Insane.
there's the point that sometimes I think people overlook is government's not the solution, it's the problem.
There is also the whole
Exactly.
issue of like patent over drugs for 15 years
Yeah.
and the generic drugs, you
Cat,
know?
cat lady, yeah, okay,
Oh,
Can
go
I
ahead.
just?
sorry.
I'd like to give just a quick, because that got brought up. Here's the thing: those drugs that are available over in Europe are manufactured here in the United States, even if they're not approved. Yeah. So, hi, welcome to the wonderful world of the American medical system.
Exactly.
All right, so it's my turn apparently, and then Francisco. So I have to respond to Francisco first. So he was saying that different treatment have different costs, and some treatments are so rare that it's not profitable to provide a cure. Okay, that that doesn't make sense, because if it's rare, that means there are some people that have a lot of demand for the cure, and whenever there's demand, there's profit. Okay, so it's not an issue of it not being profitable. It's the issue of the people who have a high demand for it. Maybe because it's rare, it would be so costly that they couldn't pay for it, right? So because the supply is, because let's say there's only a few people who need it, so if you want to supply it, the volume of the supply is so low that it can't take advantage of the economy of scale, and that's why the price tag would be so high that even though you have a very high demand for it, you are not going to be able to afford it. By the way, someone's mic is open. I'm hearing some background noise. So then what's the solution? So, but there is money to be made because people want it. Even though there's few of them, they want it. Again, our model fixes this. If you can't afford it, then the government will give you the money to pay for it. Instead of the government, so if instead of the government supplying the it's the healthcare, the solution, the cure itself, it would just be with these people. Again, when you come from the demand side, like people, when you say there's a problem, so the government should supply it, you should also explain why the government coming from the demand side would not fix this. If there's only a few people who need this service, if the government comes and, well, here's a whole bunch of money for you to give to whoever could provide it, even though now there's a low volume, the private sector would be very, very interested into figuring out a solution, because these people now have a lot of buying power. So there will be a solution to them, a better and here's why this is even more beautiful, because in the scenario that the government gets involved to provide the solution, there's only one person, one entity trying to provide the solution to these for these people. But now, if the government just gives these people a whole bunch of vouchers or a bunch of buying power to find a solution, now there's a whole bunch of different entities in the private sector trying to compete for these people's money, right? So now, instead of one entity trying to provide the solution, there's multiple entities competing for the best solution because they want all that money. And that's why this solution works better even for rare cases, right? So there's that. um Okay, so then there was somebody saying, oh yeah, there was, Asi mentioned something that I wanted to touch on, which was the fact that you, now that people have it, it's really hard to undo it. This is a huge problem with government provided services, because once you start it, even if you realize it was a bad idea, people have now become addicted to it, and the voter base will punish you for any politician who tries to take it away would get punished by the voters. So this is a drug that you should never get started on, right? Like once you get addicted to this, it's really hard to quit. So it might be even too late. Like there's no politician that would like, it's really easy to offer to get the votes, but once the people get used to it, it would be almost impossible to take it away. So don't even try. Don't, yeah, better, it might be too late. And also, one last point I wanted to make before we go to Francisco. Um, when it comes to healthcare, there's two types of competition that the government shouldn't be involved with. And if we have both of these competitions in the private sector, then healthcare will become very affordable and very high quality. So we need to have competition between healthcare providers, but also competition between insurance providers. So we have double competition, right? And if we have a lot of competition between healthcare providers in the private sector and a lot of competition between insurance providers for healthcare, then prices will drop like a rock, and that would be the best. Uh, that would be the best outcome, but it's really hard to convince people that that's actually the right solution. Anyways, Francisco.
Yeah, you answered one of the two
What was the
points I
other one?
made. The other one was about incentives. That
Oh,
the if you want to quickly respond to that, because I
Oh,
had to say
yes,
something
yes,
about the voucher as well.
yes, yes, yes. So you're saying that you're saying that if you make money from sick people, then you would want more sick people. So I was confused at first because like, how could the healthcare sector make people sick? Like that would be criminal.
Yeah, you
But then
want to
yeah,
cure as
It-
long as possible, not to
yep.
to make as much
But
money.
again, but the answer is competition will destroy that incentive, right? Because if you had a monopoly, okay, if you had a monopoly, that would be the case. If you had only one healthcare provider, that would like, oh, I shouldn't cure these people. I want these people to be customers for life. So I will just try to make them to be my customers forever and not treat them properly. That would happen if you have one healthcare provider. Okay. But if you have many healthcare providers competing with each other, as a patient, if you realize that, okay, these people are not providing me with the healthcare that I want, then then you go to one, then the incentive would be, so another healthcare provider, their incentive would be to come market and be like, hey, these assholes are keeping you sick. We won't do that to you. Look, we have the evidence, because it would be in their interest to go and demonstrate how bad their services are, right? So you would lose your customers. If you try to do that, you will lose your customers to somebody else who doesn't do that. Especially even if you can't figure it out yourself, they would be very motivated to go and show the research that you're being screwed, to steal you away from them. So a lot of these problems that you're identifying in a competitive environment will go away, because everybody within the private sector, everybody is trying to provide better services at a lower cost. That's why it's a win for the customers and the employees, actually, and the shareholders.
Yeah, I will push back a bit. So first, you say voucher for people that cannot afford it. That sounds unfair, because what happens is that instead of voucher. That's the you yeah.
Huh?
So instead of paying for people that cannot pay, people should get their debts, because there are some people that pay and people that don't, right? So it's unfair intrinsically, the system,
Okay, but if
because
it's
if you
on,
don't
if
have the
you're caring
money,
about fairness, okay, if you care about unfairness, then the government model is even more unfair.
everybody pays the same and get different
No, 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 no,
treatments
no.
based on.
No, 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 no. No, healthy people are paying more for things that they don't need via tax, and rich people are paying more into the healthcare system and using it less than other poor people.
Yeah, but the
So
system
that's
is
also
there. If
no,
you
no,
get the disease,
no,
then
no.
you have
Okay,
you go. It's
every,
like
church,
you have that covered.
whenever the government gets involved in any way, you're going to have some unfairness. But the unfairness from the supply side is way, 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 way more. Way more. I mean, every time the government gets involved, basically what you're doing is you're taking some people's money to spend on other people. Whether you come from the supply side or the demand side, that is going to be the case. So if you care about the unfairness, then you should be get the government completely out.
No, my
Not
point is,
you should basically,
why does the government give vouchers and not debts to people that cannot afford it at the time, the
because
cure?
if they can't afford it, they could also not afford the debt.
The debt can be afforded if gets repaid slowly, right? So I mean, why are you
I mean,
arguing to give
if you're
vouchers and not
providing
debts?
them some, if okay, so but if you want to do debt, then the private sector could provide debt better. We're trying, the government gets involved to do something that the privates that it's a so if you want to do debt, then why,
No, no, I don't
then you're
want.
putting poor
I'm
people
not
into
arguing for
debt.
that.
Yeah,
I like the system where everybody pays a flat
right.
thing through taxes.
Yeah,
That's
but
my
you
preferred
liking it
solution.
doesn't make it more efficient, okay? Because what, here's the thing, the model that I am suggesting also requires taxpayers to pay for it, right? Both of these could be, it is the same level of unfairness, right? At the end of the day, in both of these models, some people are paying for something that they're not using for the sake of people who cannot afford it. And if you if you count one of these to be unfair, the other one also would be unfair based on that same principle, right? So if we are, at the end of the day, if we get the government involved in anything, that's what we're doing. So we have to figure out what would be the most efficient way of doing this.
Yeah, but why would
Okay.
you give voucher and not debts? That's the question.
I guess
Because
I
people
thought,
will fraud the hell out of you.
Why would you give voucher? Because why not give voucher instead of, because I mean, so
Some people are
so
paying it
here's the thing.
and others do not.
So you went from one extreme to another extreme. Like, you want the government to pay nothing at all. I
yeah,
was
could I
talking
get
about the
them?
situation where the government. Oscar, your mic is very glitchy. I don't
Oh
know if
yeah,
you're
it's okay.
talking.
Yeah,
We
okay,
can't
okay.
hear anything you're saying. Yeah, I don't know why there's a. You sound like a
Yeah, what
robot.
I'm trying to do is to
Okay.
challenge your idea, not I'm not proposing anything.
Okay, so we're having a completely different debate. Are we? So right now we were choosing between voucher and government providing the service. So is that over? And now we're trying to come. Now we're trying having a new debate, which is the voucher versus debt.
Your idea is to basically let people pay for healthcare, but if they cannot afford it, then the government should step in and
No,
give.
so I know, but let me ask my question again. Okay, so we were comparing A to B. Okay, we could now compare B to C. But between A and B, which is the government providing the healthcare, and B, government providing money to vouchers to people to spend on healthcare, have we now established that B is better than A before we now go compare B to C, which is now a third model? Because I don't want to mix our conversation here.
Yeah, I'm leaning towards.
Okay, so now so now let's compare B to C. Okay, so we're saying government providing vouchers for people to spend on healthcare versus government providing debt, and the government will get paid back in full in model C. Is
Yeah,
that what you're saying?
yeah,
And is the interest rate the same that as the fair market rate?
yeah.
Okay, so this is basically the government not helping at all, right? This is something that you could do, the private sector. So this is basically the government not helping poor people, but making interest off of them in a way that a bank would.
Yeah, the state will be like the ultimate cover of that debt in case.
Yeah, but basically now the government, instead of coming and helping the poorest people, is like, how about I be a bank and make profit of people as a bank? That's what the government is doing. And we already have the bank for that. Why is the government? So the government has decided not to help people, but also compete with the private sector banking system now in this model. So
Yeah, but
I thought
also
we were
will be
trying to get the
like.
government to help people rather than make money off of them.
Okay.
Huh.
Y-
Yeah.
Yeah, it's a stupid idea. Yeah. But yeah, in that model, the government should pay to be the ultimate guarantor of the debt. So the government will step in if the debt is not paid. Yeah, that's
Look at what we're doing right now. Okay, so you're saying like being the guarantor has some economic value, right? Right.
yeah,
So
yes,
that whatever that value is, it would be a more simple and less bureaucratic process to just give them that value. Why add extra steps? Simplicity makes things more efficient. Whatever that value is, just give it to them.
yeah.
All right.
Oscar, did you manage to fix your microphone? No.
Nope.
Okay. Anyone?
You guys could also change the topic if you want to something else.
Joseph. Yeah,
Nice.
Joseph.
Yeah, I was listening to this, and this is where the libertarian side of my brain just went, because I I've dealt with this from several different things. What a voucher system has, its a government controlled voucher system has its advantages, just in the fact that at that point the medical provider, I should say, the healthcare providers are competing for those dollars. So that's going to help drive some of the prices down. I understand that part of the equation. The problem is that we still have it's still the issues that, like, we kind of saw with the mortgage crisis back in 2008, of not only free riders, but you're shifting the debt load. And that eventually falls on the taxpayers. And that's, like I said, what has to have, like I said, one of the things, like I mentioned before, we've got to get the government. The more we get government out of the equation, the better things are for everybody, because then we're making our choices based off of price. I'm sorry, healthcare is a product and service. And as long as the government's in there skewing all of the price signals, and to a degree, health insurance isn't helping. I mean, even private health insurance skews price signals, because we never really see how much something actually costs. To give an example, I take Novolog. Generic Novolog, a pack of 10 pens, I'm sorry, not 10, 5 pens, is currently $80 at Walmart. Now, the brand name Novolog is $800. There's a cholesterol injectable. You take it once a month, $800 a shot. So what I'm seeing when people talk about healthcare costs, I don't think they talk about the problem is that the second government gets involved, we move from a system of away from innovation into just trying to supply it. And that's a problem we're seeing in Canada. We're seeing it in the UK as well. And the other problem with, like, especially I know this from the Canadian system, because I used to live in Washington State, was the number of nurses strikes Canada would suffer from, because their nurses were woefully underpaid. There was a nurse, she was a cardiac specialist nurse at Washington State University Hospital. She actually was Canadian, lived in Windsor, just outside of BC, I should say Vancouver. And she worked 3 days in Seattle and made more than enough money for a massive home in Windsor in Canada. When we talk about lowering prices, the best ways to lower prices is you've got to get the government out of the equation. We got to get it out of, like I said, AMA has a government sanctioned monopoly on who can and can't be doctors. You got the FDA driving costs up because of the testing process. What we should see happening and be encouraging are things like what are known as health savings accounts. This is, you can take a portion of your pre-tax income, say 5%. It goes into a bank account. It earns interest. You can use it for over-the-counter drugs, medical costs, etc. Now, this is a threat to the insurance companies, because, oh, I can do this, it will earn interest. And hey, I might need to borrow against it. Okay, so I'm going to take a tax hit, but I can pull that money out of that account and use it for something else. If to me, the goal should always be moving towards freedom and liberty in our decision making processes. When the government gets involved, there's a problem. And the other part of it, and this is, like I said, this is the libertarian part of me, is taxes. The common phrase you'll hear us say is taxation is theft. And there's a reason why we say that is because taxes are collected through the initiation of force, or more appropriate, the threat of initiation of force. If we don't pay them, we're going to jail. So if we've got a system where, hey, I want to start something that's specifically for diabetics, be they type 1, type 2, because both sides have their own different needs. It needs to come from the private sector, and I can guarantee you that it'll be a better system than some bureaucrat sitting in DC, Ottawa, London, et al. It's just, I think when we talk about making healthcare better for everybody, we've got to look at more freedom-based solutions, not, oh, mommy, daddy, government, help me. Go ahead.
All right, we have Francesco, then Armin, and Armin, in your turn, maybe you want to read what Oscar, he raised his hand, but his microphone is not working. So in your turn, maybe you can address to what he wrote. So please, Francesco.
Yeah, I'm still on Armin idea. I'm stuck on that. But I have another point, which is basically logistics. Sometimes in the healthcare system, you cannot choose where you go. You just go out to the closest. It's more like providing a service than competition, because sometimes you are forced to just be and go where. So basically, whoever is in your city will be your only healthcare provider if you deal with emergencies. So that's where the free market breaks, right? Because
Say that again.
that you don't choose sometimes, because this is there are emergencies, and based on the logistics, you sometimes need to go to the closest place, and not all of them are served. So sometimes there is no competition between health provider. You're just forced to go to the one that's closest to you for whatever reason.
Okay.
And there is no economical, there is not valuable to open competition, other centers.
Should I respond?
Yeah.
It's your turn.
All right. So when you say you don't have choices, you always have more choices than when the government being involved, right? So if you identify a problem, we have to see if the government will be able to solve that, because the government will reduce choices when you have the government, and the free market almost always provides more choices than when the government is involved, right? And again, when you say that it's not profitable to add more services in an area, again, why not? If it's not profitable, then if the government notices, gives more vouchers to the people there that don't have enough healthcare in their area, then all of a sudden that becomes profitable, because now there's more purchasing power in an area where there wasn't enough purchasing power before. So now it becomes profitable to provide more healthcare options in that area. Again, all of these problems that we're being identified can still be fixed from the demand side rather than the supply side, right? I have some other points to make, but does that make sense?
Yeah.
Okay. All right. So, a couple of things I wanted to point out to. I mean, this is, I'm not disagreeing with Joseph, but the things Joseph said made me think of these, right? So, But Joseph, I think I agree with a lot of things that he says. But I just want to point to other people to keep these into mind, that um, that whenever the government gets involved, it will mean the taxpayer has to pay for it, whether that comes from the supply side or the demand side. At the end of the day, it falls on the taxpayer, right? Government involvement means that the taxpayer is paying for it. So there is no option for no tax money being spent on this. So what we have to see is which one gives us more bang for our buck, like means which one will cost less to the taxpayer and get us higher quality. And my argument is that coming from the demand side will cost the taxpayer a lot less and get you much better outcome, right? Because the government needs to be involved. Even from the most libertarian models, the government has to be involved. Like, libertarianism is not the same as anarchism. Like, libertarians, we do believe in the government involvement to some extent. I mean, if you read the book The Wealth of Nations by Adam Smith, where all of this started, he believes in positive and negative externalities for the government to come adjust. Like, the market is blind to positive and negative externalities, meaning that there are some certain things that the markets can't see, and therefore the market cannot adjust for. And that's why the government needs to come in and encourage things. So here's the reason why the market works, right? Whenever two people or two entities are trading, both of them are coming out more better off than before, because if this wasn't a win-win, they wouldn't have traded. So the argument is that more trade, better. More people trade, everybody keeps getting better and better and better, and well-being increases, right? But the problem is that when two entities trade with each other, there's a third party that is not in the trade that might be affected by it. And the market only sees trade. The market doesn't see the third party. So, for example, if A and B are trading and they cause pollution because of it, is costing a third party some negative externalities, but the market is not seeing the cost associated with that because the market only can see the trade. Or if one person is educating another person, both of them are benefiting, but the society is benefiting as well. So there's positive externality, and the market is not seeing that because the market only sees the two parties in the trade and doesn't see that the society is benefiting as well from this, right? So this is why Adam Smith argued that this is the role of the government, is to come and encourage trade that has positive externality more than what would naturally happen in the market, and somehow discourage trade than what would naturally happen in the market if it has negative externalities. So, like education and healthcare are examples of positive externalities. So there is a role for the government to come and somehow encourage it. I don't think the government should stay out. The government is good for the government to get involved in healthcare and education, even if it costs the taxpayer some money, because whatever is costing the taxpayer money, whatever is costing the taxpayer, they're getting more out of it, because the government has recognized that the society as a whole is benefiting from the service of education and healthcare. So even if the taxpayer is paying for it, they're getting a higher return from the tax. But the way to get involved is to just from the demand side rather than the supply side, because at the end of the day, we need government in some things. It makes sense to have it in some things. And when it comes to healthcare, society as a whole doesn't want to live like people as a whole. People on average don't want to live in a society where some people are too poor to to pay for their healthcare, right? Like we don't want that. Like we don't want people to say like, oh, you have enough money to live, you're poor, you die. Okay, you can't afford your healthcare, so you die, right? So in many things, like we want people like that most the collective mind of a society cannot accept that. Like we think like, okay, you haven't worked hard enough, you don't get to have a second car, you don't get to have a bigger house, you haven't been as productive, so you don't get to travel every year to a foreign country. We're okay with that. But we don't want to say like, oh, you haven't been very productive, so you die. Right? We don't want it. We don't want that. We're like, oh, you haven't been very productive, so you go hungry or you go homeless. That's too much for a society to accept, and it makes sense for the government to get involved, but again, from the demand side rather than the supply side, right? In my opinion, right? And then everything will, every time the government gets involved, it's true that it will skew price signals, but when it comes to things that are positive, have positive and negative externalities, that's a good thing, because the demand for it should have been higher than what the market sees, right? So, for example, with healthcare, if if the government wasn't getting involved because the market is blind to positive externalities, then the price should have been, there should have been more demand for this service or good, so it makes sense for the prices to be higher. And when the government gives money to people who can't afford it, to, or vouchers to people who can't afford it to spend on it, it's true that the price will go up, but this is a good way for the price to go up. The bad way for the price to go up is through inefficiency of the government and for lack of competition. That is a price increase that we do not like. Like when the government comes from the supply side, it becomes inefficient, and it also reduces competition, and that's a price increase that is not good. But why don't we want price increases? We don't want price increases because then certain people cannot afford it. But if you are actually giving money to people who can't afford it, this is a price increase that we can tolerate, because at the end of the day, where the increase in price comes with more investment in the industry, more affordability for the people who can afford it, and more competition. So,
And you
and
pay
higher
less income tax. And you
Hmm?
pay less income tax.
Well, you pay less income tax compared to the when the government comes from the supply side, but you don't. But you pay more income tax compared to a situation where the government is doing nothing at all. But I don't think that's ideal, right? And also, I think this, yeah, because if the government doesn't do anything at all, then the taxpayer doesn't have to pay anything, right, in that situation. But I think this is an example where it makes sense to government, and also I think this increases innovation. This is a form of government involvement that increases innovation. When the government comes from the supply side, it decreases innovation because there's less competition. But when it comes from the supply side, now because there's more money being spent in the industry and there's more competition, you have to innovate to be able to take that money from your competitor. So through innovation, therefore there's more demand for innovation because there's more money in the industry, right? Yeah, that's it. Sorry, I talked for too long. Oh, you wanted me to read someone's comment? Oh, yeah.
Yeah. Wait a second. I have it right here. If you
He
know
left,
want.
but he's not here.
Oscar left.
Oh,
Okay.
yeah.
So he left.
Yeah.
Uh,
By the way, guys, if
if you,
healthcare, if you guys want to change the topic, that's okay too. I know some people might not be interested in healthcare. Yeah.
so I
No problem.
have two suggestions actually for
Yeah.
topics. If the guys will choose, it would be nice. I thought the Trump's speech today cracked me up. By the way, if you want to talk about it, and about Somalia. Or if you want to stay with the healthcare thing, there's a topic that I find pretty interesting. If you want to talk about the treatment of veteran soldiers, that's also so interesting. What do you want?
Wait. Let's go to the Somali one, but let's actually. I'm gonna stop the recording here and then start a new recording so that we could post them separately. Okay, hold on.
Right.
So.